ladies and gentlemen, audience. First of all, thank you to the organizers. A perfect spot. We are all privileged to be here today because we can see through one window the Alps and the other one the Allianz Arena. And FC Bayern Munich yesterday lost, I think, 5-0. So one of the highest defeats, which is for the Munich fans a disaster. However, we should go on in this afternoon. I have the opportunity to talk about the 6G use cases from a medical perspective. I want to go first a little bit back in time. So already 100 years ago, the future of medicine was that we will use more and more support by machines. You can see there, this was steam machines, thought 1914, that will operate on us, which has obviously not happened. But the vision was clear: without technical support, no operation will be done nowadays. And this is, let's say, the Star Wars movie with the instant diagnostic and therapeutic tool was never invented. However, robots were introduced into healthcare market. First it was industrial robots, and then they were further developed. Now we have some master-slave systems on the market, which we routinely use now. We are in Germany a little bit behind of other countries, but we use robotic surgeries and robotic systems, and we could even prove that these systems are better in outcome when we use the right indications compared to the conventional systems. So there's still an ongoing struggle that in this highly competitive field of medicine, the different disciplines have on the one side to present everyday better outcomes, and on the other side reduce costs wherever it is possible. So how can this come together? Only with the introduction of, let's say, cyber physical systems, machines, or digitalization. So this digitalization in healthcare may be denominated as healthcare 4.0 according to the industry. In surgery, especially, we focus on the operating room when we talk about healthcare 4.0. It's transformed our operating room into a, let's say, cognitive and collaborative environment where we have multiple inputs from different sensors, different real-time continuous measurements that we condense, and these go into, let's say, a support unit, which is then capable of defining what operational phase we are actually in. That means, where are we now in this procedure? We can also predict the next steps, and we can offer, let's say, at the moment, semi-autonomous, but in future time, autonomous assistance to the surgical team. The problem is that this digitalization is still at the beginning in medicine, and there's a lot to do: system integration, methodologies with surgical methods, surgical data science, or let's say medical data science, cognition guidance, to put all these communications together from different instruments, units, each with each other, but also with the human user. So for the medical part or for the healthcare part, I have to say that we are still one of the least digitized sectors at the moment, if we see it overall. We have high digitalizations in certain parts, but when we see the broader range of hospitals, practices, ambulances, outpatient clinics, it's not a digitalized environment we are working in. So the traditional models, hospital and doctor-centered models, they have not the capability to deal with the growing numbers of patients. Patients get older and diseases get more. And this curve is constantly rising. So the traditional hospital and doctor-centered way, let's say, is not ready for the future. What is now introduced is what we call the smart healthcare Smart is smart, a word everything is smart now, so healthcare is also smart. What does it mean? That means, for example, intelligent, implantable, wearable sensors, medical devices, home platforms, IoT, integration in these health platforms, for example, for patients, self-monitoring, feedback of their condition back to the health records, medical diagnostic and intervention planning. So this smart healthcare is something we are now going in, and this is only possible with the inclusion of artificial intelligence. And as we think that 6G is truly an AI-driven communication technology, this can really be the possibility. This can really be the paradigm shift from the smart to the intelligent world of healthcare. However, current communication technologies are not sufficient. We've seen that in the work that has been done, that for the future demands that we have, these applications in e-health, the technologies are not sufficient. A lack of, for example, tactile feedback, manipulations with robots need very low latencies. Connectivity must be never interrupted. Cost issues, security issues, ethical questions. So there's a lot still in discussion. However, without these technological-driven AI and 6G methods, we will not put healthcare in the 21st and the centuries that are coming. So this healthcare shift now from a hospital center care, which we have at the moment, to a more virtual and distributed care is something that leverages everything, for example, from the latest technologies, artificial intelligence, cloud computing, deep learning, genomics, analytics, robotics. So this now all comes into this field. And we are not ready for that as doctors, we have to say. Okay, we are used in our hierarchic structure of how we did the med school, how we were now trained in our different specialities with a technology that is overrunning us, let's say. So we have to find a way to use these technologies in order to understand them, but also in order to use them wisely for the benefit of the patient. So will this 6G next generation telecommunication really reconstruct healthcare? I think it will, but it will take time, as we heard before, 2030 or beyond. This will not be something which is for the next years to come. Requirements was already talked about. What we need is a very high reliability, a high connectivity, securities, and also low latencies. This is everything that you know better than I know. And what can be the possible use cases? There are two main groups, I would say, for use cases. One is the intelligent, let's say, smart hospital environment. This comprises in-house communications. Everybody was in hospital of you, I think, at some point. And what we have there is paper, printed out, facsimile, nothing digital, especially in the smaller hospitals. So we need in-hospital and out-of-hospital communication structures. We need track and trace applications, for example, to optimize the patient pathways, let's say workflow optimization in the clinics, and also for the staff, for team member tracking to ensure more effective operation room planning, for example. We can track and trace high quality or high value equipment, which is not done at the moment. So use cases are there multiple. Always taking into account that we need an intelligent Internet of medical things. These data collections could be from wearables, could be from sensors, could be from different medical devices, need to transmit these data wherever they come to the different clinical information systems, can go out of the hospital and need to be analyzed and then monitored. Another use case, which is, I think, really important, is to bring the robotic sector further up by the integration of AI into these robotic architectures to facilitate personalized and precision medicine. So operations now are mainly done with these robots by master-slave systems. So the surgeon is sitting here, the patient is there, and this is then the operation site very close to each other. This can be extended. Imaging can be transferred. Emergency situations can be controlled. And this is then the next, let's say, big group, the remote healthcare, so telemedicine. This is very important, I think, in the future, that we talk about teleconferencing. That means not only conferencing, like talking to each other, but also bringing the experts to the site digitally without physical contact. Now we've seen that in the pandemic, that not every contact is necessary. This can also be a holographic telepresentation. It can be that the expert, for example, is virtually there and can really be talked with. But this is something, again, 2030, 2040, I don't know when this comes. What we have now is these robots, and I think these robots at the moment are the best use cases to work with, to make them 6G ready. The data transmissions, for example, over 6G are possible. The health monitoring is a huge sector out of clinics. The patient surveillance, for example, diabetic patients, heart illnesses, sensors, which are then tracked and traced where they are, if there's some malfunction or some bad condition coming up, giving back the information to the doctor, and tracking these emergent situations that even in such a situation, urgent care can be provided. So I would sum up that for the healthcare system or for the healthcare market, we need both. We are 6G dependent in the future, we will be, and we will also be AI driven. And these together gives us different possible applications. They will come from the healthcare 4.0, so cognitive operation units, cognitive medical units. They will come from the IOMTs, for example, blood sample sensors, where it's not necessary anymore to put a syringe in the patient to take blood, but to measure it through the skin. All these intelligent wearable devices, diabetic, hypertension, nephropathy, everything which is needed surveyed, and every patient has to come to the doctor for doing that. This is something which is not for the future, I think, for cost effectiveness, reasonable to do. And then the intelligence or the smartness in the hospitals and the smartness of the telemedicine, telemanipulative systems. And with that, I would like to conclude. And if there are any questions, I'm here or there, please ask. Thank you very much.